I'm Dr. Michaels with the Reconstructive Foot and Ankle Institute, and today we're going to talk about Charcot, or Charcot neuroarthropathy. Now, oftentimes people have diabetes and they lose sensation in the feet, and that causes problems. Sometimes a normal foot looks like this, and sometimes the foot can collapse where you have a normal arch, but it inverts. So your foot breaks in the middle and it collapses, and that's called Charcot. And so what happens is that the longitudinal arch of the foot collapses as time goes on in people who don't have feeling in their foot. They have good blood flow, but their feeling goes away either through alcoholic neuropathy, diabetic neuropathy, heavy metal exposure, any kind of exposure that causes you to lose your feeling in your foot. You can develop Charcot. It was originally noted about 100 years ago in leprosy colonies because leprosy would cause absence of sensation in the foot, and then this Charcot would set in. It makes it really hard for people to walk when your foot is broken in the middle and you walk on your medial arch. Oftentimes you develop holes in the bottom of your foot in the middle because these bones are starting to stick out the bottom of your foot. And the way that happens is the foot actually breaks. And so if you walk, and you and I walk all the time, but if you walk, normally you have a lot of feedback coming from the nerves in your foot. And that feedback tells your brain you have to move your foot a little bit to control your foot on certain angles of the ground. If you're walking on uneven terrain, you have to fire your muscles to walk normal. But if you don't have feeling, you don't get that feedback. So you're just walking on the ground like a loose bag of bones. And what happens is you develop these small little micro fractures in your bones. They get bruised, and you don't really feel that though. And so you keep on walking on your loose bag of bones. And over time, those little micro fractures or bone bruises begin to get bigger and bigger. And they actually cause your bones eventually to give out and break. And now your nice arch starts to flatten and flatten and flatten until the bones in the midfoot are sticking out the bottom of your foot. They've actually worn holes in your skin, and now the bones are sticking out, and the bones themselves can become infected with bacteria, which is called osteomyelitis. And if that happens, oftentimes we have to cut out those bones. So Charcot is a really dangerous disease. It doesn't affect very many people, but we do see it in our practice. Oftentimes we can easily help people out with Charcot with bracing. So oftentimes we will take a cast of their foot and make a brace that goes inside a shoe. So the brace actually takes the pressure from the foot and transfers it to the leg. And so when people walk, they still can't feel. And they're still going to do that damage unless they wear a brace. And if you wear a brace, then you don't have that trauma because the pressure that goes on the foot is actually being transferred to the leg, which will prevent any further breakdown. And so the person with Charcot can go lead a normal life and walk around and do what they've got to do. But if they don't treat it, it can get worse and worse, and they could eventually possibly lose their leg with a below-the-knee amputation. So to prevent that, it's very simple to come do an office visit. Let us diagnose it, and let us get you the braces that you need to walk. This all can be done without drugs, without surgery, and without anything invasive, which is really a nice way to treat a condition. So Charcot means basically you're breaking down your foot. Your foot's broken because you can't feel anything. And so it just gets worse as time goes on if you don't treat it. So to stop Charcot from getting worse, you have to simply make an appointment and let us inspect your foot to see if that's exactly what you have, and we can make a brace for you that'll stop the progression of Charcot and possibly reverse it.